Hi, my name's Molly Bird. I'm a trainee clinical psychologist and I'm here to talk about my research project, which I undertook as part of the UCL Clinical Mental Health Sciences course and in partnership with the UKRI Loneliness Network. My project focused on loneliness in young people, and we aim to investigate third sector staff perspectives on the strategies and barriers to reducing loneliness in young people with mental health difficulties. We conducted semi-structured interviews with 14 staff members from 7 third sector organisations around London who worked with young people aged 14 to 24 years. A community organisation staff member provided feedback on the interview schedule, and interviews were analysed thematically. The staff were all female and aged between 18 to 54 and had a range of job roles such as youth workers and centre managers. Staff reflected that most of the young people they supported were from low socioeconomic backgrounds, and many were experiencing mental health difficulties, and some young people had been diagnosed with intellectual disabilities. Overall, staff mentioned that the young people they worked with didn't tend to discuss loneliness with staff, and only one organisation had developed strategies explicitly targeting loneliness reduction, whilst the rest identified strategies they felt perhaps more indirectly reduced loneliness. 6 main strategies were discussed, and these included one-to-one emotional support, offering group trips outside of the centre, encouraging external social inclusion activities, offering group sessions within the centres, outreach to trusted spaces, and involving wider networks. And importantly, these strategies suggested that improving opportunities for social contact and social connectedness were seen as key in reducing loneliness. Additionally, most organisations tended to use a mixture of some of these strategies, and we wanted to extend this a little bit further by asking staff how and why they felt that these strategies were seen as effective in reducing loneliness. And from these discussions, 2 main themes were developed. The first theme was providing a safe space, and this really grouped comments from staff on the importance of building trust, being consistent, and providing an open space for services for young people. And this was felt related to improving opportunities for open communication and for self-disclosure, which staff felt might reduce loneliness. A second theme developed from the data was labelled Seeing the Person, which captured discussions surrounding the importance of staff getting to know each individual young person, and from this being able to tailor their support to each young person's specific needs or interests. And these aspects were felt to improve a sense of belonging, of feeling valued, which staff felt improved engagement in services, and perhaps through these psychosocial processes of group identification and social connectedness might be reducing loneliness. In terms of barriers to engagement, staff reflected they felt that there were 3 main barriers, which were stigma, both of mental health difficulties and of loneliness itself. There was interpersonal difficulties and being unaware of community organisations, and these were all highlighted by staff as potential barriers to engagement, and which they felt kind of exacerbated loneliness in the young people that they supported. So to summarise, the organisations we interviewed discussed a mixture of strategies which they felt might indirectly support with the reduction of loneliness, via potential mechanisms such as building on group identity, social connectedness and psychological processes in the young people. Additionally, stigma, interpersonal difficulties and being unaware of services were all raised as possible barriers to accessing community support, which staff felt might delay support and perhaps exacerbate loneliness. Importantly, future research should work in collaboration with young people to continue to investigate strategies to reduce loneliness. I just want to say a big thank you to all the staff members that we interviewed as part of this research, and thank you to my supervisors, Dr. Mary Birkin and Professor Sonia Johnson, and to my research partner, Hannah Cocker. Thank you very much for listening.